Hi friends, my name is Dr. Ranganath and welcome to my YouTube channel. Today is World Anesthesia Day, also called as the Ether Day. 16th of October every year is celebrated as World Anesthesia Day to commemorate the first successful demonstration of anesthesia in the year 1846 by the anesthesiologist Dr. William TG Morton. This was done using the chemical diethyl ether for the first time successfully in the Massachusetts General Hospital in the United States of America, which is now attached to the famous Harvard Medical School. This is considered as one of the major milestone or breakthrough in the history of modern medicine. This ensured that the surgery could be done without causing pain to the patient. The theme for this particular year is medication safety, which ensures that the patient receives the correct medication at the right dose, at the right time and at the right place. The modern medicine has grown beyond leaps and bounds, and today we are able to perform complex surgeries like heart transplant, lung transplant and so on and so forth. All these surgeries wouldn't have been possible if not for the advancements in the field of anesthesia. As a surgeon, it is difficult for me to even imagine the modern medicine without actually the field of anesthesia. Many people, especially in India, are scared of anesthesia, and this is as a result of some stray incidents of complications or even death as a result of anesthesia. And one should remember that the chances or incidence of death as a result of anesthesia is extremely rare, and this is roughly 1 in 1 lakh or 2 lakh surgeries. That is, if there are 1 lakh or 2 lakh surgeries that have taken place, there is a chance that one person might actually have some complication or might die because of the anesthesia related complications. So risk is a part and parcel of every walk of life. There is an element of risk while we are riding a bike, there is an element of risk while we are driving a car, and there is also an element of risk while we are doing air travel in a plane. So every walk of life has an element of risk associated with it. And similarly, there is an element of risk associated with the anesthesia or the surgery. And it is quite evident that the anesthesia in present day is extremely safe. The surgeon, the anesthetist and the entire hospital staff constantly makes an effort to improve the safety of the patient. The theme for this particular year, that is medication safety, is also linked to the safety of the patient itself. So don't be afraid of anesthesia and get your surgery done if at all it is required. Apart from what the healthcare staff is doing, as patients, you can take some steps to make the anesthesia and the surgery more safer. The first and the most important thing is keep yourself healthy, as the chance of complications increases significantly if you have multiple diseases like diabetes, hypertension, heart disease and so on. Tell everything about your health issues, like what disease you are suffering from, any medications that you're taking, or if you are allergic to any drugs or food. So what it does is helps the operating team to take better care of you during the operative procedure. Get a pre-anesthetic checkup done, especially in elective procedures. That is, meet the anesthetist well before the surgery so that they can detect any unforeseen problem, and if at all they are detected, they can either be corrected or optimized. Maintain your nil per oral status. That is, you're not supposed to eat or drink anything at least 6 to 8 hours before surgery. And if at all you have eaten something, even as little as a single biscuit, make sure that you tell the operating team, because they will reschedule your surgery, which is very important, because operating on a full stomach or any food inside the stomach significantly increases the risk of complications as a result of aspiration pneumonia. That is, the food content from the stomach can actually go inside the food pipe and cause various complications. Never forget to thank the anesthetist after the surgery, because the anesthetist is as important as the surgeon. It was the anesthetist who was taking care of you while the surgeon was operating on you, and if at all you have come out of the operating theatre safely, this is because of the skill of the anesthetist. So on this World Anesthesia Day, let us all congratulate the anesthetist for making the surgical experience easier, safer, not only for the patients but also for the surgeons, and give them the respect that they deserve. If you found that this video was useful, please like this video, share with your friends, and please subscribe to my channel. Thank you.